Hi, everyone. Thank you so much for joining us for this series of webinars that will focus on diversity, equity, and inclusion. I'm Dr. Denise Martinez, the Associate Dean of Diversity, Equity, and Inclusion at the Carver College of Medicine and an Associate Professor in Family Medicine. The goal of this series is to learn, reflect, and think about one's own ability to impact equity in your life and also here in your role at UI Healthcare. This webinar is provided for educational and informational purposes only and does not constitute providing medical advice or professional services. We appreciate you taking the time to learn more so that we can make UI Healthcare a more diverse, equitable, and welcoming environment for all.
Hi, my name is Eleanor Lisa Labadie Gomez, and I'm a clinical assistant professor of family medicine here at the University of Iowa. And I'm excited to visit with you today to talk about the effect of COVID on vulnerable populations, especially within the Latinx community. The goal of the presentation is to create awareness, to talk about some of the issues that I have seen as a primary care provider during the COVID pandemic and caring for the Latinx community. I have worked in primary care for 10 years and at the University of Iowa for 4 years and within the West Liberty community for nearly 6 years. In that time, I have been able to develop really wonderful relationships with my patients and their extended families. And I've learned a lot about how heterogeneous the community is, but also the similarities among them. It's important to consider how there might be similarities between the Latinx community and the Congolese community, as you will be exposed to some of these issues that are affecting these vulnerable populations in the Midwest and in our community here. I'm going to take a broad approach to paint a more clear picture of some of these issues as it pertains to the Latinx community. This will be kind of a wide lens approach. And you know that there are many differences between families, so just take that into consideration. I also wanted to highlight the use of the word Latinx. I was curious about when this word first originated, and it was first seen online around 2004. Used to describe non-binary gender identities within the Latino-Latina community, and was seen as more of an inclusive term, specifically for gender identity. And then about 10 years later, it became more widespread and accepted among academic institutions to describe sort of an ethno-cultural identity. There's been some controversy, as with the use of any word, to describe just one population. And it's known that this term is becoming more widely used outside of the United States, but primarily it's used within the United States to describe this population. It may be a word that some people use to identify themselves with, but there might be other terms that they use, such as Hispanic or Chicano or Chicana. So I encourage you to learn more about your patients and what words they would use to describe themselves without using a blanket term. But for purposes of this presentation, we'll use Latinx. So I think we're going to kind of do a question-answer format, and I know Dr. Del Castillo has some questions for me, so I'm ready to answer.
Tell us a little about the Latinx community.
So within Iowa and the Midwest, and specifically to our state, the U.S. Census Bureau estimates that Latinos, Latinas make up 6% of the Iowa population. They account for about 20% of the COVID cases that we've detected so far during this pandemic. Nearly 70% of the Latinos in Iowa are US born and 30% are foreign born. In 2018, about 77% of the families included children under the age of 18, and 10% of all Latinos in Iowa are under the age of 5. So it's a young population. The median age is 24 compared to all Iowans, 38.2 years of age. So this kind of gives you a little kind of flavor of the Latinos in Iowa. And as it pertains to the occupations that they hold, they tend to work in areas that are considered essential for a community. They work in high density occupation areas. It's important to recognize that they work in the farm fields. Many will come here seasonally to work in the fields as labor workers. Some will also work in meat packing plants, in milk dairies. They will also work in construction, in addition to fast food places, establishments, and warehouses, such as Oral-B, Procter & Gamble, Alpla. These are places that will package our toothbrushes and where they package all sorts of plastic bottles that we use for our toiletries. These are the kind of occupations that they will hold in our community. Amana and Whirlpool is another place that employs many Latinos. And as you can see, their work is very intensive. They can work 12-hour days, sometimes 14-hour days. And for many of my patients, when I first started to work with them, my first question was, where do you work? What are your work hours? And I learned that many patients would work third shift or second shift or first shift. And it helped me understand a little bit better how I could make their medication recommendations specific to their time of day or work hours. Oftentimes for meat packing plant workers, they will tell me I go in at 7 a.m. and then I go home when the work is done. So it's not like they will clock out at 5 p.m. and they're done. West Liberty Foods will process, if I remember, up to 20,000 animals per day, and some plants up to 30,000 animals per day. And line work is very rigorous. So this gives you a little bit of information about some of the Latinos here in Iowa and the occupations that they employ.
What are the major barriers that the Latinx community face when trying to access care for COVID-19?
There are certainly still a good number of Latinx community members that may be undocumented, and or potentially they don't have insurance based on where they work. If they are undocumented, there is probably a fear of, if I seek care, is this going to open up the door to someone realizing that I don't have papers, and could I potentially be deported back to my home country? For those that have health insurance, even if they have health insurance, if they work in a meatpacking plant, for example, and I'm more familiar with the ones locally in our community, they have a point system for attendance. So if they miss work, even if it's for absence to come to the doctor, they can get a point. And if they accumulate so many points, that can lead to their termination. So there's actually an incentive to not miss work. And you can imagine if a labor worker is working 5 or 6 days a week, sometimes 7 days a week, and making maybe decent money to support their family, if they feel a sniffle or a fever, they might not think, well, I'm going to miss a whole day of work for this. I'll just work through it and I'll push through it. So even if somebody does have health insurance, the previous culture was to disincentivize leaving work if you needed to seek health care, rather than taking the time off to protect yourself, but also protect your coworkers. Some of the other barriers include having proper childcare. There are many families that will work opposite shifts, so that while one parent is working third shift, the other parent will be with the children and take up either a first or second work shift. Imagine that you have a household with a mother and a father, some children, and one of those parents becomes ill. They have to self-quarantine. Well, then that leaves the other parent to have to figure out how to take care of their children, and or should they still go to work? And how do they care for their loved one who has to be in quarantine? Those barriers continue to be present. And this is just considering that maybe there's a mother, father, and children living in the household. If you think about Latino families as compared to US families, about a third of Latino families are multi-generational households. So that means there could be a grandparent living at home, or an uncle or an aunt, or a brother and his wife and their kids, so there can be multiple family members in the home. If one person gets sick and they're not able to self-quarantine in the home safely, then it puts all others at risk, all the way from the youngest to the oldest. And I have seen this in my patient population. The challenges that they experience not only include access to care outside of the home, but even being safe in the home. And that is something that I've been aware of as I take care of my patients.
What are some of the unique concerns among this population related to COVID-19?
I think one of the unique concerns is their place of employment. So as part of the essential workforce, the meat processing employees are encouraged to continue their work. It's an essential work. Our food chain relies on having access to the meat that they process in that plant, whether it's Tyson or West Liberty Foods. Some of their customers include Subway or some of the other fast food chains. So you can imagine by disrupting the source of food in one place, that can affect a cascade of other sources that are reliable on this source of food. In this situation, these workers are working very close to one another in their workplace, where previously their personal protective equipment might have included a helmet, steel-toed shoes, earplugs, maybe some work glasses, and throw that on top of working in a very cold environment, which it would be like the temperature of a refrigerator, essentially to keep the meat safe. Or if you work in another part of the plant, if you're working as a machine operator, you're constantly in movement and having to go from place to fix machines as they break down. Or you're working in another room where they mix the meat and spices and it's very warm. So the circumstances of their work make it very difficult to even protect themselves from one another in case maybe a member a coworker decides to go to work, has the sniffles. They're working in a very close confined space to the next person, and they're not able to self-isolate or work in a safe place. I think that's unique to this population in the meatpacking plants. And you can also see this in other warehouses and other places where they're working in close contact with others. There are some people that have jobs where they may not necessarily be in close contact with others. They might drive a forklift or operate an automated, what they call caballo, which is basically a horse. It helps load items on pallets. So these workers are constantly on the move. And you can imagine these are jobs that require that they be there. Think about your job as a provider. You maybe can work from home, maybe you can do some telemedicine. Even as a provider, you're considered an essential worker, but your work can be translated to a different environment. But for this population, they have to go to work. They cannot work from home. They cannot take a few days off, or they cannot take maybe vacation time that they haven't saved up. They usually, because it's a migratory population, they often will travel home to their home countries for weeks at a time and saving up all of their vacation for that time. So they might be also less inclined to use vacation time if they're feeling ill to care for themselves.
What barriers does this population face as it relates to testing positive for COVID-19?
I would like to even talk about getting the access to the test. In March, I believe March 8th was the first day that COVID was detected in 3 citizens here in Iowa. And it wasn't until the end of April that there was a concerted effort to do widespread testing for workers at the meatpacking plants. One of the meatpacking plants was in Waterloo that was tested over the course of a couple of days at the end of April. And then West Liberty Foods also had their ability to test their coworkers for a couple of days. Getting the test itself, I think, can be frightening, especially when you are being told that other people in your community are falling ill, or maybe one of your coworkers has died, as we know that there were deaths within the West Liberty community and Columbus Junction and other parts of the Midwest. There can be fear about the unknown, the uncertainty of how do I get this virus, or what can I do to protect myself? They, in the meatpacking plants, when they were tested, a colleague of mine was there actually administering the tests, and they recalled how many patients were very worried and concerned just about lining up to get tested, and they were uncertain about what it was going to feel like, the nasopharyngeal swab, plus they also had an antibody test. And if English is not your primary language and you're lining up to get tested, that can be very frightening. Once the test results are back, some of the barriers are just being able to communicate with the patients once they test positive, being able to call them. Sometimes when you call somebody's home phone, their phone number is disconnected or they didn't pay their bill, so you can't get through to them. Unless if you know the community really well, you're not going to be able to access that patient. And I've worked in the community long enough that sometimes I know cousins of friends, and I can get a hold of a patient that way, but that's not a luxury that all providers have. So communicating with the patient is one important aspect once they get the positive test. It's not enough just to test, but also to communicate those test results. When you communicate test results, it's not as easy as saying, hello, Mrs. Ramirez, you have a positive test. Then you have to go into a little more detail about what that means. What does a positive test mean? Does it mean I'm going to die? Does it mean that I can't work again? What are the implications for my health based on a positive test? So it involves making and taking careful steps to explain the information as clearly as possible. Many patients in meat packing plants or other blue-collar jobs have different levels of education. Many can read and write in their native language, but there are people that can't. And finding a way to communicate results to them that you feel that they can understand at their level is important. Reassuring them where it's necessary, but also educating them about what to be on the lookout for and to anticipate maybe what their next question might be. We also had to communicate with them that they would be receiving a home kit to take their blood pressure and oxygen levels at home. And there was some process in making sure that we could deliver these kits to them, but that they would receive them and know how to use them. In addition to that, there was some process that we would notify patients if we were unable to get a hold of them, that there would be a courtesy call by sending a police officer for a visit, basically a welfare check. And I can only imagine that if you're undocumented and you're already afraid to seek care, and they have mentioned that the possibility that there would be a police officer coming to check on you, you probably wouldn't answer your phone. And I think that's another important thing to consider for some of our patients that might be undocumented, that could be a big obstacle to seeking care, is just the fear of whether or not receiving help will promote them being deported back. And then some patients who are on the process to becoming naturalized, there's a concern about what is called public charge and whether or not if they receive any governmental assistance, if they will have to pay that back and if that will affect their immigration status. These are some of the unique barriers that I think have come up within this population, just starting from your initial question of what do they do with a positive test? Well, first we have to talk about how they get tested in the first place and whether or not they have an access to a test. And then once that test is positive and that's communicated to them, ensuring them that we are going to take care of them, that they will be regularly observed and followed. And they may need to come in for further evaluation if their symptoms show that potentially there's a decline or deterioration in their vital signs. So providing that reassurance along the way has been critical.
Are there any additional recommendations that you have for healthcare providers who have patients from the Latinx community?
I'm glad that you asked that question because I know that we can come up with a lot of stories about how difficult it is and how challenging it is, but there are also ways to find solutions and help. I definitely would encourage asking, among your cadre of colleagues if they work in the Latinx community, and if not, then reach out to some of us in primary care and family medicine because we've worked intimately with this community for many years. I would encourage you to think about some of the social organizations within the Iowa City area, especially like the Center for Workers' Justice. There are also organizations such as Iowa Legal Aid that may be able to help patients who have questions about their immigration status and missing work. But also workers' rights in the context of, can I take extra time if I'm still not feeling up to par? Who's going to protect me? As a provider, what you will do is leverage your powers to fill out FMLA forms, for example, to ensure that the patient's job is stable when they return. And sometimes that means using an extended time away from work, maybe a gradual return to work if their symptoms are not yet 100%. Work with the patient and learn about what you feel that they can accomplish when they go back to work. And if they don't yet feel ready, then it's your job to protect them and advocate for them in that context. I also recommend advocating, within your community, if you know any lawmakers or legislators, to advocate for this community in terms of, food security. We haven't talked really about a lot of the families that are, working blue collar jobs, might be working paycheck to paycheck, might be on food assistance, might be worried now because their kids are home and their kids are not at school, how to arrange for making sure that there's enough food at home. Also, if they're not working because of the pandemic, how they're going to pay their bills, if they're going to have to worry about getting their electricity shut off or their running water turned off in their home. Some of the local agencies can help navigate some of these obstacles. And I found a really wonderful website at www.humanrights.iowa.gov. And this is great information under COVID-19 for providers to learn about community resources that are available in this specific aspect for our Latinx community. I'd also encourage you to, learn about your patients, learn about what they know about coronavirus, learn about where they get their information from. I've had really meaningful conversations with my patients, learning about their sources of news. You learn about their fears. You learn about how well that they've perceived the information and what they know about the importance of hand hygiene, the use of masks, the proper use of masks, social distancing and why that's important, and also seeking care when they need it. Remember that Latinx communities are multi-generational communities, that family members rely on one another and they're resilient and they depend on one another. They may have created alliances that we don't know about that are hidden underneath the surface. And I've had some patients, for example, a young woman who's a single mother, get COVID-19. She developed symptoms on day 9 after being detected with the illness and had to be hospitalized. and a close family friend took care of her daughter while she was in the hospital and remained with her daughter until the quarantine for her illness was over. There was no agency to help find her to say, do you have a child? How can we help you? This was something that they built within the community. There's also Facebook website, Facebook pages for community members to kind of reach out to one another. And their faith is a really significant component of how they're reacting to this pandemic. My patients are very proud about their faith and how they feel that the higher power that they believe in will get them through this, but they also understand that they have to obey the rules of the land of being on earth to practice hand hygiene and social distancing. So by reinforcing this message to them, you will make them ambassadors for their community.